Friends, in the previous session we have seen about sex differentiation in various bones like skull, pelvis and femur. In connection with this, we are going to see now other medically important facts about the bones. First, sometimes we have to decide whether the given specimen is bone or not. Sometimes rubbles like stone or burnt wood may mimic like bone. In the situation, how to fix it is the bone. That is by seeing the gross anatomical structure. For example, if it is a bone, it will show some morphological characters like presence of greater and lesser trochanters, or presence of muscle and ligaments attachment, all these, which are absent in the rubbles. Second is by microscopic examination for the presence of bony characteristics like presence of Haversian systems which are present only in the bone. Third is by chemical analysis for the organic and inorganic constituents of the bone. After deciding the bone, then we have to decide the origin. Again, if the whole bone is available, we can easily say it is a human or animal skull like that. Suppose a part of temporal bone is only available, then it will be difficult. Or if the bones are of small in size like phalanges, metacarpus, metatarsus like that, we cannot exactly tell whether it is human or animal. Suppose in the examiner asks you how are you saying it is human skull or human pelvis like that, your answer should be based on morphological features, it is a human skull. In the situation, we can confirm the origin by doing the test, which is an immunological test based on antigen-antibody reaction called a precipitin test. For that, we have to take the saline extract of the bone in a glass tube, and keeping the glass tube upright in the slanting position, along the sides of the test tube, we have to add 2 or 3 drops of anti-human precipitin serum. The serum will go and settle at the bottom. Then within some 10 to 30 minutes, suppose if it is human bone, then that antigen in that saline extract reacts with the antibody in the anti-human precipitin serum, forming a white ring of that precipitate at the interface of two liquids. If there is a formation of that white ring of precipitate, then it is the human bone. If it is an animal bone, that animal antigen won't react with the anti-human precipitin serum, so there won't be any visible ring of that white ring precipitate at the interface. That means the precipitin test is negative. In this way, we can confirm the origin of the human bones. Not only the human or animal bone, we can determine whether it is human or animal hair, human or animal tissues using the same test. Similarly, we can determine the origin of human body fluids like blood, saliva, semen like that. This precipitin test, PRACA-P8AN, that is precipitin test is applicable only up to 15 years old specimens, bones, because up to 15 years only we can extract plasma proteins from the bones. Similarly, precipitin test cannot be done in case of cremated or burnt bones because of the unextractable plasma proteins. So, after deciding whether it is a human or animal bone, other methods include that again by this chemical analysis of the bone ash, or by this histological examination for Haversian canals which are different between human or animal bones. Also we can determine whether it is human or animal. Similarly, by DNA fingerprinting also we can do it. Then third question is whether the bones are of same or different individuals. Suppose if the entire skeleton is there, by doing the reconstruction, by articulating all the joints, if all the bones are properly articulated, then all the bones are of same sex, same age, same size, showing same morphological features, then it will be of the same person only. Suppose if there is a mismatch with respect to size, race, sex, morphological characters, or if the bones are not properly articulated, or the same side bones are there is a reduplication. Suppose two femurs of the left side like that are present in the cluster, then it cannot be of the same individual. It should be of different individuals only. So this way we can make out whether the bones are of same or different individuals. Other methods include exposure of the bones to the short wave ultraviolet lamp examination. The bones of the particular person will emit a certain spectra of colors on showing to short wave UV lamp. So the bones of different persons can be segregated using this because there will be difference in color emissions on exposure to short wave UV lamp. Then other methods include neutron activation analysis as well as X-ray tabular pattern differentiation between individuals. Then by DNA fingerprinting also we can certainly make out except this identical or uniovular prints where the DNA fingerprinting may be same. So by DNA fingerprinting we can exactly fix the identity in that situation. Next question will be how to determine the race. That question arises generally in case of mass disasters involving shipwreckage or aircraft accidents or twin tower collapse where people from a different ethnicity are victims. In that situation we have to first find out the race. From the skull, race can be identified by studying the various morphological features like the size and length of the skull, shape of orbit, nasal aperture, palate, etc. Then, by doing metric measurements using various indices, one such index that is applicable to skull is called cephalic index or breadth index. That is maximum breadth of skull divided by maximum length of skull multiplied by 100. Maximum breadth is measured by using a spreading vernier caliper between two farthermost points on the two parietal eminences. Okay, two parietal eminences. This is the point, farthermost point. That gives the maximum breadth. Maximum length is assessed using the same caliper anteriorly between glabella. That is the point between the two eyebrows. Whereas posteriorly, the farthermost point on the external occipital protuberance. That gives the maximum length of skull. Breadth by length multiplied by 100. If the value comes between 70 to 75, it is of dolichocephalic or long-headed skull. The race could be of some of the Caucasians, especially pure Aryans, then Aborigines. Aborigines means the original inhabitant of any country. Then Negroids, they are long-headed. Suppose the value comes between 75 and 80, then it is called mesocephalic or medium-headed. Here the race include some of the Caucasians, especially the Europeans and the Chinese. Suppose the value comes between 80 and 85, it is called brachycephalic or short-headed. All the Mongoloids are having this brachycephalic skull. All the Mongoloids except Chinese. Chinese have mesocephalic, we have already seen. Indians, cephalic index also mesocephalic, similar to Europeans, with 75 to 80. The skull of Indians is said to be having more Caucasian features with some Negroid characters. So after determining race from using the cephalic index, the examiner may ask you how to determine race from the long bones like femur, humerus, etc. That is again by applying indices called brachial index, crural index, humerofemoral index, then intermembranous index. Just remember these names of these indices which are applicable for race determination from the long bones. Then next question comes determination of sex. We already discussed how to determine sex. From the DNA fingerprinting also, sex specific banding patterns of DNA we can make out whether this male or female bone. Here you can be asked Kragman's accuracy in sexing of long bones. Already I told in the previous video, the entire skeleton is available 100% from the pelvis, 95% accuracy, which is the most reliable because it is modified for parturition. And next comes the skull with 90%, femur and 80%, pelvis and skull together 98%, pelvis and long bone together 98%, like that. Then comes the age at death. What is the age of the person at the time of death? Age can be assessed from the skull bones based on the uh, teeth eruption. Up to 25 years, we can determine the age, both in living as well as in dead. The deceased or dead persons or in the skeletonized bodies like this, after 21 years, age can be assessed by applying Gustafson's method or Gustafson's formula. That is by looking for the various degenerative changes like adhesion, parodontosis, etc. that occurs after 21 years. Anyway, that applies only in the dead persons. Next comes age determination from the various fontanelles and sutural closure. The posterior fontanelle closes. The posterior fontanelle closes at 2 months, whereas anterior fontanelle, specifically this posterior fontanelle closes between 2 and 6 months. We can keep it as 2 months. Anterior fontanelle closes by 2 years. The metopic suture in between the frontal bone that fuses generally by 3 years, more accurately 2 to 8 years. Some individuals, even after that period also, in 5 to 10% of population, it may persist. It doesn't fuse. That is called a persistent metopic suture or metopism. The right and left halves of the mandible, two halves of the mandible fuse in the midline by 2 years. Coming to age estimation from sutural fusion, which are very important. Here we are generally considering sagittal, coronal and lambdoid sutures. Generally the sutural fusion occurs from the endocranium to ectocranium direction, from inwards to outwards. In the skull you can see the sagittal, lambdoid, coronal and all not fused, whereas in the skull you can see these sutures are completely fused here. Ectocranially, let us see what are the ages that this sagittal suture fuse. First, we have to divide the sagittal suture into 3: posterior third, middle third, and anterior third. Start from behind. Posterior third fuses between 30 and 40 years. Skip the middle third. Go to anterior third. That fuses in the next decade, 40 to 50 years, and lastly, the middle third, 50 to 60 years. So posterior third 30 to 40, middle third this 50 to 60, whereas anterior third 40 to 50. Similarly, coronal suture divided into 2: lower half, upper half on either side. Lower half fuses by 40 to 50 years, upper half on either side fuses between 50 and 60 years. The entire lambdoid that fuses between 40 to 50 years. Some books saying it is 45 to 50 years, like that. So how many 40 to 50 examiner may ask you? That is a lower half of coronal, anterior third of sagittal, and the entire lambdoid you can say. Suppose the given skull ectocranial sutural fusion is completed, we can assess the range based on whether posterior third or anterior third, like that. Suppose in this skull like this, if it is not fused, then we have to see the corresponding area in the inner table. Suppose the posterior third or sagittal suture not yet started fusing, then we have to see whether in the endocranially it has started fusion or not to fix the age. Endocranial fusion occurs 5 to 10 years earlier than the corresponding area. Suppose if it is 30 to 40 years posterior third, here the posterior third or sagittal suture fuses 5 years at least earlier. We can keep it as 25 to 35 years. So the examiner may ask you, if there is no sutural fusion occurs endocranially, what is the upper age limit? Age is less than 25 years. If the sutural fusion starts endocranially, what is the age? Age is 25 years and above. Like that we have to remember. As far as this sagittal suture is concerned, it is more common to have non-union even after the prescribed years. That is called a lapsed union or a non-union of these sutures ectocranially. As far as reliability is concerned, sagittal suture is more reliable for age estimation, followed by lambdoid suture, and the least reliable is the coronal suture. So We have seen various Kenyan sutures. Now coming to base occiput and base occiput and base sphenoid fusion. This is base occiput, base sphenoid. The fusion occurs here. That occurs between 18 to 21 years. If it is fused, we can keep it as above 18. If not fused, below 21 years. So we have covered all these important cranial sutures, including base occiput and base sphenoid, that are also important. Then age assessment as far as the mandible is concerned, based on mental foramen position. In the infancy, it is positioned lower, closer to the lower border of the body, whereas in the adult, it is positioned in the midway between upper and lower border, like this. Whereas in the old age, it is positioned higher. The mental foramen as in this mandible positioned higher because of the regression of the alveolar margin. It is located closer to the alveolar margin. Again, age can be assessed by medical legal angle. We have discussed in the previous video. Upper border of the body and anterior border of ascending ramus, that angle, otherwise called this medical legal angle. In infancy and old age, it is more obtuse, more than 140 degree, whereas in the adult, it is almost right angle, 90 degree. Then in the infancy and old age, the condyles, they are positioned lower. They are at lower level compared to the coronoid process, whereas the adults, like in this mandible, the condyles level is higher than the level of coronoid process. Then coming to long bones age assessment, age can be determined by studying the ossification activity both by gross examination as well as by X-ray examination. The living, we can take the X-rays. The last one to fuse is the femur, is the lower end of femur with the shaft. That is, fusion occurs between 18 and 19 years. So in this femur, it is fused, we can keep it as age is more than 18 years. Suppose if it is not fused, the hyaline cartilage is there in between the epiphysis and diaphysis, then we can say less than 19 years. From the pelvis, age can be assessed by ossification activity. The last one to fuse here is the ischial tuberosity, that occurs between 20 and 21 years. Here it is fused, so age is above 20 years. If it is not fused, less than 21 years. Then sacrum, that fusion of sacral vertebra, that is by ossification of the intervertebral disc that occurs from S5 to S1 vertebra, from below upwards between 21 to 25 years. Sacrum becomes a single bone between 21 to 25 years, where that ossification of intervertebral disc occurs the below upwards direction. In some of the sacrum, you can see a gap between S1 and S2, the intervertebral disc. It is called a lapse reunion. Even up to 32 years, sometimes beyond that also, this may persist. This is called a lapse reunion, which you have already seen in the sagittal suture also. This is somewhat common. Even in this sacrum also, you can clearly see the lapse reunion between S1 and S2. Now, next comes the important criteria, which is considered as the single best criterion for age estimation. Of all the methods of age determination, single best criterion for assessing the skeletal age after 20 years is by studying the various degenerative changes in the symphysial surface of the pubic bone. We have to disarticulate and see the symphysial surface. This is the symphysial surface. After 20 years, there will be degenerative changes. Based on the changes, we can determine the age in decades, say 20 to 30 years, 30 to 40 years, up to 70 years, which is the single best criterion for age estimation after 20 years. So with this, we have discussed about how to assess the age from the bones. Then comes the stature. Stature estimation from the long bones, from the skull, commonly it will be asked. When you are talking about skull, maximum that height of skull into 8, that gives the approximate stature of the individual. height of the skull is assessed between the this brachma, and this anterior, this midpoint of anterior margin of the foramen magnum, that is called a bastion. Between brachma and bastion we have to measure, that gives the height of the skull, multiplied by 8 gives the approximate height of the individual. From the long bones, age estimation. Generally the femur constitutes 27% of individual's height, whereas tibia constitutes 22%, whereas humerus constitutes 20%, and spine, roughly one third of the individual. The length of spine constitutes about 35% of the individual's height. Coming to multiplication factor from the length of long bones, we have to measure the length using Hepburn osteometric board, HEPBURN, Hepburn osteometric board. Length of femur is measured from this point, uppermost point on the head, to the lowermost point on the medial condyle. Multiplication factor is 3.7. If you divide, since it constitutes 27%, 100 by 27 comes around 3.7. That is a multiplication factor. Whereas for tibia, it is you have to add plus 8 to 3.7, 4.5 for tibia. Similarly, for humerus another 0.8, 5.3. That is for humerus 5.3, and for radius it is 6.5. Radius 6 letters, 6.5 you can round by. Then various formulae for stature estimation from the long bones, from the length. That is a Carl-Pearson formula. That is a KRLPEARSON. Carl-Pearson formula. Next, another formula is tubertus and Haddon. DUPERTUIS. Tubertus and Haddon. HADDEN. Then comes Trotter and Glasser, TROTTER and Glasser, GLESER. These three formulae are important. Examiner may ask you. The fragment of the bone alone available, still we can determine the stature by using Steele's method, STEELE, Steele's method. Okay. Now, stature estimation for the long bones and the skull, that is important. Then comes what is the cause of death. Suppose if there is any gunshot injury, gunshot hole, entry and exit are there, or any depressive fracture called signature fracture secondary to hammer blow with the head. The circular depressive fracture is present, otherwise called signature fracture. That indicates that the person would have died due to hammer blow. It is a case of homicide like that. Then any cut fractures, any defects, suppose a person is attacked with a axe, heavy weapon, there will be a triangular shaped cut with one side blunt, other side sharp and all like that, matching with that of the dimensions of the cutting edge of the axe. We can tell about the cause of death, all these. Suppose natural death can be assessed if there are malignancies, evidence of malignancies there, like that. If the bones are found in a very burnt or charred remains, then we can say a person would have died due to burning. Coming to cause of death from the long bones, two things are there. One is heavy metal poisoning like lead, arsenic, mercury, thallium, antimony, that and all can be chemically detected even in several 100 years old bones. Okay. Even in the burnt or cremated bones also, still we can make out these poisons. So heavy metal poisonings like lead, arsenic can be determined from the. For that, 10 cm of shaft of femur is sent for chemical analysis. Then another cause of death from the long bones is diagnosis of drowning death based on the diatoms test. We have to, from the bone marrow, we have to scoop out the bone marrow and test for species of diatoms, which has been detailed, given in detail in the textbook. Please go through that. If that species of diatoms recovered from this bone marrow of that deceased person matches with that of the that species of the diatoms recovered from the drowning medium where the body was found drowned, that species of diatoms in that water and in that bone marrow are of same species, then we can say the person would have been died due to drowning. Okay, that too it is a case of antemortem drowning. So, drowning and heavy metal poisoning we have to remember. They may ask you regarding cause of death. Suppose Any bullet or pellets are found embedded in the long bones like femur or skull, that also indicate the cause of death. Or any broken tip of knife is found embedded here in the bones, then the person could have been stabbed like that. So cause of death can be made out from the bones. Then time since death, how old these bones are. Based on the putrefaction changes or decomposition changes, up to 6 months, bones are soft, greasy to touch, emits a foul odor, all these. From 6 months to 1 year, soft tissue ligaments, tendons, ligaments, especially in the joint areas, they are still found adherent. More than 1 year, they won't be present. After that, time since death can be assessed by fall in nitrogen ion content in the bones or fall in C14 carbon dating, otherwise called C14 carbon dating, or fall in C14 carbon. That is more useful in more than 5 decades old bones. Then fall in amino acid content. All these are helpful in determining the time since death. Then, how to identify the bones based on congenital or any acquired peculiarities like fractures. Any surgical procedures, orthopedic procedures with nails, plates, screws are there. From that, by perusing the hospital records, we can identify the individual. These are all some means of identification. Of course, as we have already discussed, DNA fingerprinting can be done from the bone marrow cells, which except in unival organs, identity can be uh, fixed. Then ABO blood grouping also can be determined from the bones. These are all certain facts which will help to establish the identity from the bones. Then nature of injuries also we have to comment. Whether the injuries, suppose fractures are there, antemortem or postmortem fractures. Then the if it is a cut fracture like that, the edges are clean cut, then it could be having cut by a sharp weapon. Suppose in case of bones being gnawed by animals, or if it is hacked or sawn, then edges may be irregular in shape like that. So with this, we have concluded these various medically related facts other than sex from the human skeletal remains. In the exam, you have to comment all this. For example, you have to write in the opinion. Individually, you have to determine the sex as all the bones are won't be of same sex. The exam you will be given the skull and pelvis may be of male and female certainly may be of female only. So all the bones won't be certainly of the same sex. Then you have to say they won't belong to the same individual because sexes are different. So individually you have to determine and comment about that. For example, for the skull, you have to tell it is a human skull, then it is of a male or female sex based on the features. Then you have to tell about approximate rough age. So you are not able to calculate, at least write this suture fusion age, basic occiput, basic sphenoid, ossification activities, teeth, all these you can write for age assessment. Then stature also you can write about various multiplication factor and the formulae. For race you can write about cephalic index and all. Then cause of death, if there are bullet holes like that, you can straight away write a person could have died due to gunshot injury. Otherwise, you can say cause of death is unascertainable or undetermined. The bones are without any deformities or any fractures or any defects. Then if the fractures are there, we have to tell about antemortem or postmortem fractures, etc. The exam, you have to put the title for each bone. It is a human skull. Then you have to make 5 columns. First column, trait or feature, that is glabella, forehead like that. Second column, male. For example, glabella, how it looks like in male. That is more prominent. A forehead is steeper. The female, normally how it looks like. Glabella is less prominent, forehead is vertical or round full like that. Fourth column, observation. The given skull, what you are observing about that, all the features. Given skull, again, suppose it is a male skull given, you have to write in the fourth column, it is steeper, forehead, glabella is more prominent like that. Last column, fifth column is the inference or sex. According to the fourth column, your observation, you have to comment against each feature, male or female, etc. You have to mention the sex against each. And finally, you have to give the opinion, that is a human skull of male sex, of age and stature, in case of long bones, all this. Thank you.